Good morning. It being 9 o'clock-ish, I'm going to bring to order the Capital Project Overview Committee meeting. Our first item is the acceptance of minutes from Monday, September 29th. I'm sorry, from the June 30th meeting. Motion, and I apologize. Let me apologize right up front. I have an ear infection right now, and hearing is very difficult for me. So throw something at me if I appear to be stalled or something anyplace here. So thank you. The motion's been made and seconded. All those in favor say aye. Opposed? None. Moving on to new business. Under RSA 12-G:46, Roman numeral 3, Harbor Dredging and Pier Maintenance Fund established. Capital Project 25015, Pease Development Authority, Division of Ports and Harbors. Request prior approval of the Capital Project Overview Committee to spend up to $125,000 from the Harbor Dredging and Pier Maintenance Fund for the purpose of replacing the floating docks, the recreational pier at the Rye Harbor Marine Facility, as specified in the request dated September 10, 2025. Welcome, sir. You're up. Please state your name for the record.
Good morning, ladies and gentlemen. My name is Richard Hartley, Hartley. I am the acting director of the Pease Development Authority Division of Ports and Harbors. As the chair indicated, I'm here to request funding to replace a 99-foot deteriorated floating dock at Rye Harbor. The dock is used for unloading and offloading thousands of passengers each year for various charters and whale watching tours. In your packets are pictures of the current dock to illustrate its state of disrepair. In addition, the division obtained an estimate from a local marine construction company and is requesting prior approval for an amount not to exceed $125,000. Thank you for your consideration for this request and for access to the Harbor Dredge and Pier Maintenance Fund to replace the dock. I'm happy to answer any questions.
Do we have any questions for the gentleman?
Thank you.
Seeing no questions,
I move the,
Representative Edgar moves yes on the item, and it is seconded by Representative Weiler. All those in favor say aye.
Aye.
Opposed? Motion carries. Thank you, sir.
Thank you, Chair. If there are no further questions, I would like to extend an open invitation to provide you as a group or individually to our deep draft terminal in Portsmouth, New Hampshire, and our many recreational commercial use marine facilities such as the Portsmouth Fish Pier, Rye Harbor, Hampton Harbor. Again, thank you for your time and consideration.
Thank you. Under miscellaneous items, we have none. Under informational items, we have a number, Capital 25011 from the Department of Administrative Services. They provided their quarterly capital budget project report for the quarter. Under Capital 25012, Community College System of New Hampshire is a report on critical maintenance projects. If we have any questions, they are here to ask. If none, we'll just move on to the next item. The next item is the Pease Development Authority Division of Ports and Harbors, Harbor Dredging and Pier Maintenance Fund expenditure on the fish repairs, also informational. And also 25014, the Pease Development Authority Division of Ports and Harbors, another Harbor Dredging Fund expenditure report for informational purposes. Our final one was a request by Representative Erf from the Department of Health and Human Services, Capital 25016, presentation of capital projects supporting closed loop referrals, September 29th, 2025. Representative Erf, any questions, please? And would the representatives from the Department of Health and Human Services please step up? and identify yourselves. Welcome.
Thank you. David Wieters, Chief Operating Officer, DHHS.
Good morning, Marissa Henn, Deputy Commissioner, DHHS.
Thank you. At this point in time, I recognize Representative Earth.
Thank you, Mr. Chair, and thank you all for being here. Perhaps you could first go, I sent you a list of questions, save some idea what I'm interested in, and you also produced a pretty detailed description of the project. Maybe you could just go over that first and answer my questions that you feel like answering as it relates to that.
Sure, I'll do my best, Representative Earth. Thank you for the questions. So hopefully in front of you, you have a copy of the slide deck that we shared. I'm going to go over the background really fast. I know in the interest of time, I'm going to try to answer your questions as we go along. And Representative Earth, please let me know if I'm not answering those. So the closed loop referral program, which is part of the Beneficiary Service Improvement Capital Project, and I say part of because the Beneficiary Service Improvement Project is funding multiple different solutions for the department, which we'll go into. But specifically, New Hampshire Care Connections is a network of healthcare and human service providers. So what that means is we're trying to join both our human service providers like shelters and food pantries along with our healthcare services to do that closed loop referral functionality to support the citizens of our state. I'm not going to go into details on the background, but I can certainly go into them if people want me to. On the next slide, where you see the capital fund supporting the closed loop referral project, specifically on this, I focused in on just the capital funds. So there are general funds that are in other parts of the department as well as in other departments supporting these programs. But this capital project was a 90% federally funded project and 10% general fund project to provide self-service capabilities for Medicaid beneficiaries. And this was goaled at digitally transforming our environment through online capabilities for our providers and our clients to communicate that. And so when we look at that, there's a number of components associated with that. So this project of $8 million is broken down on that slide to show that the first component was a planned provider module for the Medicaid Enterprise System replacement. And that's for providers to register and process claims for all of their Medicaid beneficiaries that they're providing services. That one's still in process and will be released as an RFP future in this fiscal year. And then third-party liability is another component of this capital project, and that is for ensuring that Medicaid is the last payer. So we basically are goaled at using software to ensure that if someone has another insurance provider or another way in which to pay for their health care, that we have a system to show that, inquire that. That's what the third-party liability system is for. It's a component, again, of the Medicaid Enterprise System strategy. The last two are part of the New Hampshire Care Connections, and they're combined to provide better care coordination throughout our state. Event notification, which is for admission, discharge, and transfers of patients between healthcare organizations. And that one is currently in its maintenance and operations phase with our point-click care vendor. And then the closed loop referral is the project that we're working on right now in design and development and implementation, where our goal is to interface and leverage this solution across all of our health and human service providers so that they can have a closed loop referral. What that means is right now the current process for providers to refer for services is they use a fax or a phone or an email to another provider and say, hey, do you have availability to help this person? They may not get a response. They might not know if that provider is actually providing the services. So then it's upon the client to seek their go back to the emergency department, go back to their provider. We're trying to eliminate some of the duplicative effort by having a closed loop referral system. So moving through this, I think some of your questions, Representative Earth, through the LBA were some of the successes and where some of our opportunities were and where we're at with this specifically with this project. So our successes have been, we've been We published an online resource inventory, which allows for contact information services, costs, population served, eligibility requirements, and map for finding services, along with we implemented a migration for rapid response processing. So this is crisis response for the 988 suicide prevention as well as crisis services. That solution, its contract was ending. We migrated it to this solution so that they could have no break in service. And then we also launched an engagement campaign with our community mental health centers, community-based organizations, federally qualified health centers, and hospitals. So as you'll see in the slide deck, there's some websites where you can get more information about the New Hampshire Care Connections Network. The event notification system we implemented across over 140 skilled nursing facilities, hospitals, and community mental health centers so that they can have a track board to understand where are their clients, not other people's clients, but their clients. So if you saw them at an ED, now they're discharging to a community mental health center or another DRF, you can actually see that they're being admitted at that new location and that they're being seen and the services are being provided. Moving to the next slide, from an opportunities perspective, where we're working on right now is continued business process management, which really is a fancy word for change. As we change the behaviors of using faxes, phones, and emails to a new system, there's an opportunity for communication, education, training, and movement onto this platform, along with expansion of data analytics, which you asked for. Will we submit that information for the legislature? As we get the data analytics and people are on the network and providers are on the network, we will be publishing the publicly related information on our website, but any of the protected health information or consent-based information would not be published or accessible. So you would expect to see those type of visualizations off of the website that's linked to in this presentation as they're developed. And then the other formation that we're working on is an executive external steering committee so that we can partner with our providers in our state, along with other departments like Department of Military Affairs and Veteran Services has been part of this project from the get-go. Other opportunities you can read on the event notification is similar: change management, data analytics, and really continued engagement for expansion so that people, providers, not people, but providers can leverage the admission discharge transfer functionality. As you may have been aware from previous presentations, not to this committee, but Public Works and Highways, the event notification system was initially implemented for compliance with the 21st Century Cures Act, so that all hospitals or providers are obligated to have an automated way in which to communicate with their other providers for admissions, discharge, and transfers. From wrapping this up from a project timeline, you can read the background, but we worked on a lot of consent management, participating agreements to ensure that we had all our legal and privacy and security ducks in a row. And then now we're focusing on provider engagement, steering committee, and integrations with those systems. And integration specifically is to reduce that data entry perspective where you have to type it into your provider system and then type it into another system. Our goal is to integrate those systems where possible. I may have left some of the answers out, but I'm open to questions to the committee, and thank you, Chair, for the opportunity.
Thank you. Any questions? Representative Burr.
Thank you, Mr. Chair. A question that came up just in your presentation, when you were talking about capital versus operating, sort of. A lot of the information, I've been looking at this for the last, well, the project's extended since 2020, so I've been reviewing that for the last few years. And the most relevant document, I believe, is the most recent Executive Council note that they approved, where they approved this contract, basically. And that note uses only the term closed loop referral system. which you now tell me is capital only. And yet that note, if you look at it, it talks about, there's definitely more to it than capital expenses. So I'm just wondering, you don't need to answer this right now if you can't, but if you could just, for me, break down that, because there's three components of that note, three different accounts that are discussed in there that don't, it's not clear how your breakdown of project components fit into that accounting breakdown, if you will.
Thank you for the question. Certainly, we can provide you the breakdown. And just one note of clarification. The information I shared with the capital committee today is only the capital funds. The closed loop referral system and event notification system both have non-capital funds supporting them for maintenance and operations. And only the capital work is what I represented here today.
Yeah.
Further questions?
So thank you for that. And I understood that, but just it's not clear from the contract documents what's what. That's all I'm saying. I'd just like to point out that this project was initially let or was going to be sole source back in 2020, and that didn't go forward. And then then it was let again a year or two later, and the wrong bidder won, so they killed that. And then this final contract I'm referring to now was the one that was actually let. And over that entire time, the research that I've done indicates that none of this was ever presented to either the Capital Projects Committee, or perhaps this one piece you're referring to, but in general, what we're talking about here, or to the Finance Committee. And I know we've talked about this before, Mr. Readers, but I think that I'm hoping that going forward, we'll learn more about this, because I do think, although it's not a lot of money, $8 million is probably in the scheme of things here, not huge, but it is a dramatic change to the way the state is doing business, and there is certainly some question in my mind whether it was even necessary. And I know there's a difference of opinion here, but I just wanted to get that out there and let you respond to it if you want to.
Thank you for your comment. Certainly understand your perspective, and we have had those conversations previously. The beneficiary service improvement was discussed at the Public Works and Highways. You are correct that because it expanded across multiple different projects, the details of those individual projects were still in planning phase and were not discussed at that committee specifically. The previous funds for the 2020 implementation were not capital funds, and they were during the public health emergency that resulted in the sole source. And again, having an avenue to have that conversation is definitely an opportunity that needs to exist, I believe.
Thank you, Mr. Chair.
Yeah, is there the opportunity for Representative Erf to follow up with you offline if he has any further questions?
Absolutely. And I did receive some questions this morning that I can respond to the LBA, Christopher Shea, and he can disperse that back to or for this committee as needed.
Thank you. Representative, here we go again. Senator Waters.
Thank you. I did like being a representative for my terms. I did, but I'm the other body. Good morning. And I imagine that you have a user response mechanism built into this, and I was wondering how people are responding so far to the use of this new system.
Certainly. So as with any change, there's mixed responses, but a number of people are very excited. Very large organizations are excited to get this off the ground. So this idea wasn't really born out of DHHS. It was born out of 1115 waiver many years ago, where the integrated delivery networks came up with the idea of better care coordination. And many hospitals and providers have been pushing the state to be that lead facilitator for the state so that we can move this forward as a state network. So I would say that overall positive feedback has been given to the state being involved in this solution and coming up with a way in which to bring all the providers, both health and human services, together. The how to do it is where we're having some conversations and continue to change the process, which is normal in every business process change that I've gone through in my career.
Follow.
I was kind of wondering as well about the patient experience.
That's a great point. From a patient experience, we're still in the design, development, and implementation perspective, so I don't believe we would have enough providers on the network to actually show the patient experience at this point.
Thank you. Any other further questions? Seeing none, thank you very much. Well, excuse me, Senator Lang.
I apologize, I came in a little late. You may have answered this question, but provider coverage, how many providers are we looking at across the state that have decided to opt in and use this program that you're supporting?
That's a good question. Thank you very much for the question. The answer right now is we have 84 providers on the network, and the main, and we're looking to expand. So the previous implementation had additional members, and we're working to expand that. And what we focused on the last year is to ensure compliance with the RSA for privacy and security of the individuals, which required some additional work for consent-based management, opt-in based consent, and that's where we have gotten to. We have a number of other providers engaged right now to move forward with network participating agreements.
Oh,
So when you say provider, would Capital Region Healthcare be one provider, or each healthcare provider individual? When you're talking about it, I'm trying to understand the scope of engagement, if you will, with the medical providers in the state for an $8 million investment.
It would definitely be individual providers like Dartmouth Health or a specific hospital or specific clinic. Capital Region Healthcare is, I'm not sure specifically if they represent a number of providers or if they're one provider, like doing business as one provider. So it's really looking for an individual organization that's doing business as one taxpayer ID would be a provider.
So I think maybe the question you're asking, an example would be Dartmouth Health. It includes all of their clinics, both ambulatory, inpatient, hospital-based. My understanding is that one provider would be a health system, not just an individual bricks and mortar practice.
So, one more follow. So
Final
again,
question.
if we can get an idea of how many actual physicians, how many people are actually being covered, which gives us the scope of thank you.
seeing no further questions, thank you very much for coming and presentation. Let's talk to Mr. Shea about setting the date of our next meeting, please.
So Representative Mills had asked me to look into when we could meet at Granite Place for our next meeting, and that would be December 9th at 9 o'clock. It would be room 228 within Granite Place. And that's a Tuesday, as Pam whispered to me. 9 a.m.
Seeing no big objections so far, so be it.
It's Tuesday.
Yes, a Tuesday.
Is it not a Tuesday?
Yes.
Okay.
January, not December.
And the reason that the Tuesday was chosen is that Representative Mills' committee has control of that room on that day. So it was easier to schedule.
Right.
But as Senator Gray points out, as the session gets started, we may need to look at how we schedule these meetings to fit everybody's schedule. So.
All set. Then I will entertain a motion from Senator Lang. Motion has been made and seconded. All those in favor say aye. Opposed? We are adjourned. Thank you.